Hi, my name is Dr. Victoria Barbosa, and I'm excited to talk to you today about getting to great hair. I'd like to thank the Myositis Association for inviting me to speak to you today. First, I'd like to introduce myself. I am a board-certified dermatologist and an associate professor at the University of Chicago. I'm also a former cosmetic industry executive from many moons ago, where I worked in research and development as a vice president for several years. I'm a hair and scalp disease specialist, and I take care of a lot of people with hair loss and other scalp problems. So in the next few minutes, I'd like to provide you an overview of the basics of hair and hair growth, talk a little bit about how you find the right hair care regimen for you, and I'll address the 5 most common problems that get in the way of people having great hair. And let me just say this. I know I'm talking to the Myositis Association folks. And for some people, especially for folks with a lupus associated myositis, hair loss can be a feature. Most folks with myositis don't have specific related hair loss, but everybody wants better hair. So I'm going to keep my comments very general. So, what makes great hair great? When you think about just a great head of hair, for most of us, we think about hair that is thick and strong, hair that grows as long as you want it to grow, that is shiny and manageable. And all of this contributes to, an overall great appearance. And we want hair to achieve what we want it to achieve style-wise, right? That hair that behaves, if you will. And when we think about these characteristics, what I want you to know is that some of these are factors that we can control or improve. And some of these factors, we're born with and are not so easily changed. And it's important to know the difference. So hair density. The scalp has 100 to 150,000 follicles, and all of your follicles are present at birth. It's interesting to note that there is some variation in follicle density among people of different ethnic backgrounds. But you've got what you've got at birth. We don't make more follicles, but over time as we get older, and especially as we approach menopause, the follicles do get smaller late in life, and some of them start to produce hairs that are finer or stop producing hair altogether. There are 3 phases of the hair growth cycle, and the one that's really important to achieving hair length is the anagen phase. That's the growing phase. Catagen phase is the transitional phase, and telogen is the resting phase just before the hairs fall out. Most of your hairs are in anagen phase at any given time, and that anagen phase usually lets you grow somewhere between 3 and 6 inches of hair per year. There is no way to change the rate at which your hair grows. And also note that it's normal to shed about 80 to 150 hairs a day. So there are really 2 factors that play a role in how long your hair will grow. One is how fast it grows, and we just talked about that. But the other factor is how long your follicles are in that anagen phase. For some people, the growing phase only lasts 2 or 3 years, and then the hairs fall out. And for some people, the growing phase will last 5 or 6 years. And so you can imagine someone who has a 2 or 3 year growth phase at 3 or 4 inches a year is not going to have the same length of hair as someone who's got 5 inches of growth a year for 5 or 6 years. Now, the good news is that we can slightly modify the anagen phase and lengthen it to help you achieve longer hair. But nature is really what's most important at play here. When we think about shine and manageability, that's really about the quality of the hair fiber, right? So shiny hair has nice, smooth cuticles that reflect light. Also, sometimes the amount of sebum that comes from the scalp and travels down the hair contributes to the shininess. But of course, too much sebum leaves the hair flat and oily looking. Manageability is largely a factor of the curl pattern, with straight hair or wavy hair being easier to comb and manage, and with curly hair requiring a little extra care. So these are our cuticle goals, right? Nice, smooth cuticles as seen pictured on the left. Whereas on the right, you see damaged cuticles. So you can imagine that that hair wouldn't have as nice an appearance. Cuticle damage comes from heat styling, chemical styling, overprocessing, etc. And again, here is a beautiful example of a curly hair. This is a hair taken from an African American person. And you can see the hair changing direction along the length of the hair and having different curl diameters at different points on the hair. So we have to be really extra careful to condition and take care of African American hair. So when you think about your hair care routine, most people think primarily about shampoos and conditioners, as you should. And we think about the shampoo frequency, the type of shampoo, the type of conditioner you use, and then, of course, the different styling products that you use to maintain your hairstyle, particularly to attain the style and then to maintain it between shampoos. And I'm just going to focus for a minute on shampoos and conditioners. So, people shampoo with different frequencies. Some people shampoo every day. Some people shampoo every week or every other week. And some people, particularly with braided styles that are protective, may only shampoo once a month. And all of that is okay. In general, I recommend somewhere between once a day to once every 2 weeks. Now, the main ingredient in the shampoos, the ingredient that does the heavy lifting of cleaning the hair, they're called surfactants. And these are chemicals that have a water-loving end and a lipid-loving end. The lipid-loving end attaches to the sebum, the oil, the dirt that's in the hair, and then the water-loving end attaches to the water that washes it away. So it really is important to use shampoos with surfactants to get the hair clean. And then there are these other agents that do things like give the shampoo a foamy feel, which we like, but are less important in the actual work of the shampoo. So there are different types of surfactants that are categorized by what their charge is. And most shampoos are either anionic surfactants or amphoteric surfactants. The anionic surfactants do a really good job of getting the hair and scalp clean, but they can be a little harsh to the hair or irritating to the scalp, depending on your level of sensitivity. So many shampoos will make use of the amphoteric surfactants, which are much gentler. And the ingredient that people often will see on the amphoteric shampoo is the cocamidopropyl betaine, as opposed to the ALS or the SLS that we commonly think of. So if you're looking for a shampoo that's more gentle, you're going to look for one with an amphoteric surfactant. And if you need something that's really going to do a good job cleaning, you want an anionic surfactant as listed. The cationics are usually used in conditioners. Conditioners are important because they reduce the combing force so that you get less breakage when you comb your hair, and they moisturize the hair, and they can protect the cuticle. So we think back to what that nice smooth cuticle looked like as opposed to the damaged one. Conditioners can be rinse out or leave in, and how much conditioner you need really depends on the condition of your hair and how porous it is, and how often you use shampoo as well. So some people will need to use conditioning products in between shampoos, especially if you're only shampooing once a week or every other week. So let's dig in to what might be getting in the way of your having the hair that you want. I'm going to talk about the 5 most common hair and scalp problems. Number 1, dandruff. The medical term is seborrheic dermatitis, but you don't need to be a doctor to recognize this, right? The little white or yellow flakes that can occur on the scalp, and you often see them on your black shirt or dress. The good news is that you can usually address this yourself with over-the-counter shampoos containing either zinc parathione or selenium sulfide. But if the over-the-counter shampoos aren't doing the trick for you, then you should go see your dermatologist, because we have prescription shampoos and we'll sometimes combine them with topical steroids to reduce the inflammation that leads to the flaking. So don't let dandruff ruin your day. we can help with that. Number 2, stress. Okay, who doesn't know something about stress? Well, stress can contribute to many different forms of hair loss, but the real stress-related form of hair loss is called telogen effluvium. And this is where all of a sudden you start noticing clumps of hairs that are coming out every time you comb or brush. You're looking down on your dinner plate and there's hair on the plate. It's just everywhere. And if you look closely, you'll see those little white balls that signal that those are the telogen hairs on the ends of many of those hairs. Telogen effluvium can be triggered by many different types of stress, including emotional stress, medications, illness, inflammatory scalp conditions, etc. So you want to address any dietary issues that might be contributing. We sometimes see this when people crash diet. You want to manage your stress and be patient because this will end. And minoxidil, the over-the-counter hair growth medicine, can actually lengthen the anagen phase and is sometimes helpful. But if this has gone on for more than 2 or 3 or 4 months, you want to see your dermatologist to rule out some underlying diseases. Third most common problem, well, actually, first most common problem, just the third one I'm talking about, is male and female pattern hair loss. This common form of hair loss can start anytime after puberty, but often we see in women around menopause, and we see slightly different patterns in males and females. Women tend to have a widening at the part, men tend to have hair loss at the temples and at the vertex. It's caused by a sensitivity to dihydrotestosterone, which causes miniaturization of the follicles. And so treatments are aimed at reducing the 5-alpha reductase or blocking the DHT that contribute. That's more than you may care about, but let me cut to the chase. There are some over-the-counter treatments. There are hair growth supplements, some of which work, some don't. There are laser caps. You can use 2 or 5% minoxidil. I like 5%. And you can always hide the hair loss with keratin fibers or even something like a wig or a weave, depending on how much hair loss you have to cover. There are also medical options, so you should absolutely see your doctor to assess vitamin and mineral deficiencies and to talk about topical and oral medications. In addition, there are some cosmetic procedures, including platelet-rich plasma, which is injecting plasma back into the scalp, or even hair transplant to permanently conceal areas that have thinned. Sometimes your hairstyle is just not your friend, so you want to be careful about chemical overprocessing, excessive heat use, and minimizing hair accessories that cause damage or styling that's too tight, because all of these things can cause fraying of the follicles. Thermal breakage from a curling iron. Sometimes you leave it on a little too long and a curl breaks off. Damage from a ponytail holder. The elastic is like a little scissor cutting those hairs. And traction alopecia, hair loss from pulling from tight braided styles. So you want to minimize damage by using fabric-covered scrunchies, avoiding glued-on hair weaves, keeping your heated styling appliances like your flat irons or your curling irons on low heat settings, reducing chemical use, and definitely spacing out relaxers and hair dye. And if you wear braided styles, you should rotate those styles and the braids should never be too tight. Finally, some people have hair and scalp diseases and really do need a doctor. So whether you have frontal fibrosing alopecia or central centrifugal cicatricial alopecia, etc., or discoid lupus on the scalp, you're going to need to partner with your dermatologist to manage those problems. And the sooner we are able to treat you, the better off you'll be. So don't hesitate to see your dermatologist if you've got severe itching or burning or sustained shedding, or your problem isn't controlled by over-the-counter remedies. Finally, just recognize that we're not all dealt the same hand, but we can all do the best with what we've got. You choose a routine that matches your needs and control what you can control. And don't hesitate to see your dermatologist. I'd like to thank you for your attention, and I invite you to please stay in touch with me on Instagram, Facebook, or by email.
Well, hello everyone. My name is Dr. Oluwakemi Onajin. I'm an assistant professor of dermatology and dermatopathology at the University of Chicago Medical Center. Today I will be discussing skincare tips for dermatomyositis. I have no conflicts of interest. So first, let's start by defining dermatomyositis. This is an autoimmune inflammatory disease that commonly causes a characteristic skin rash and muscle weakness. Dermatomyositis presents as a purple or violaceous, red, itchy, and painful rash that can appear on the face, eyelids, knuckles, chest, back, elbows, and knees. But honestly, you can get the rash anywhere, especially on sun-exposed areas. Dermatomyositis can also cause non-healing sores or ulcers and hard lumps under the skin that are called calcium deposits. This is usually more commonly seen in children with dermatomyositis, but adult patients can also get these calcium deposits, or what we call calcinosis cutis. Amyopathic dermatomyositis is a term that we use to describe dermatomyositis with the characteristic skin rash, but without any evidence of muscle disease. So usually patients with amyopathic dermatomyositis don't have any muscle weakness or symptoms, and when we check their muscle enzymes, those lab results are normal or negative. So how does dermatomyositis present in the skin? So there are many ways that it can present, but it can be very classic. You can get the heliotrope rash, Gotrins papules, a rash on the face, the shawl sign, V-neck sign, scalp rash with hair loss, nail changes, calcinosis cutis, as we mentioned, are calcium deposits, and mechanic's hands. I'm going to go over each of these terms and show you photographs. So the heliotrope rash usually presents as a purple or violaceous rash or red or discoloration on the eyelids. You can see this is it in a darker skinned patient. You can see her eyelids have this reddish discoloration, but it can actually look a little more brown or purple in darker skin. That's why I'm showing darker skin patients so that you can see how different it can look on darker skin. And then you can see the facial rash in the middle. And this patient has this reddish rash all over her face and also on her neck. Here, this is a patient that has hair loss in addition to these changes in her scalp. She first presented when her dermatomyositis was active with very itchy scalp and also a red scaly rash on her scalp. And with time, she lost the hair there and developed alopecia. And now she has these post-inflammatory changes, or post-inflammatory hypopigmentation or hyperpigmentation. Here you can see the nail fold changes. And typically what we see in dermatomyositis patients is that their cuticles look very thick, and they also have these very visible blood vessels along the proximal nail fold. Here is a patient with Gotrins papules. You can see these pink papules on the knuckles and also on the tips of her fingers. And here is a patient with mechanic's hands, and these patients get scaly, dry, hard plaques or patches on their fingers, along the sides of their fingers or on their palms, and that's why we call it mechanic's hands. Here is a photograph of the shawl sign. And this is a patient that has what we call poikiloderma, which is a term that we use to describe specific changes on sun-exposed areas. So in poikiloderma, what you see are red areas, which correspond to blood vessels. You can see white areas and also brown hyperpigmented areas. So this patient has the shawl sign. But I wanted to also show it to you on a darker skinned patient. As you can see, that redness really isn't that visible. but you do see these brown dots all around here, and there's a little bit of pinkness, but you can see it's in the distribution of a shawl in the upper back. And this is a patient that has the V-neck sign and the upper chest. So how is dermatomyositis of the skin diagnosed? So usually a dermatologist like myself performs a thorough skin exam and will note the classic findings, and a skin biopsy is usually performed. Now, how is a skin biopsy performed? Initially, we inject a numbing medicine called lidocaine under the skin, and then we use a special tool called a punch tool to remove a small piece of skin. We put stitches in, and we send that piece for processing. And then a dermatopathologist, also like myself, will look at this skin biopsy using a microscope. And you can see here the skin biopsy will be processed on a glass slide, and a dermatopathologist will look at it under the microscope. And this is what we usually see in patients that have dermatomyositis. We see there's too much inflammation under the top layer of the skin, and there are also lots of these small tiny holes. And then we also see lots of white space deeper in the skin, which corresponds to mucin, which is a substance that's commonly deposited in the skin in patients that have dermatomyositis. So how do we treat these skin symptoms? Well, systemic medications such as antimalarials, including hydroxychloroquine, chloroquine, and quinaquine, can be used. Other medications that suppress the immune system, including methotrexate, mycophenolate mofetil, and azathioprine, can also be used. And then medications like dapsone and thalidomide have also been used with some good results. IV or infusion medications such as IVIG and rituximab can also be used, especially for our patients that have severe disease when they do not respond to any of the other medications. And some emerging new therapies for dermatomyositis include tofacitinib, which is a type of JAK inhibitor, apremilast, and linabazum. Topical medications are usually also prescribed, including topical steroids and topical tacrolimus or pimecrolimus. And then patients with dermatomyositis are usually very itchy, so we use a combination of oral and topical medicines to help with their itching. We cannot talk about dermatomyositis without stressing the importance of sun protection. Okay, so sun protection is very, very important when in patients that have dermatomyositis, because it can cause your skin to flare and make it very difficult for your skin to respond to treatments. So we always recommend sun protective clothing, sunscreen, always seek shade when you're outdoors, and avoid being outdoors during the peak periods, which is usually between about 10-11 a.m. and 4 p.m. So let's talk about sun protective clothing. I always recommend that my patients with dermatomyositis wear wide-brimmed hats, and this is to cover their entire face and also their neck. Also, you can purchase lightweight long-sleeved shirts and then pants too that have UPF or ultraviolet protective factor in them that block the rays of the sun. Sunglasses are also very important to protect your eyes and your eyelids. Shoes to cover your feet, and if you don't wear shoes that cover your feet, always put on sunscreen, and we're going to talk about sunscreen in a bit. I also recommend that my patients who are driving wear gloves, and we sell these gloves on Amazon and in the clothing stores, and you can wear the gloves when you're driving to protect your hands, especially for those patients that have the Gotrans papules. So the gloves will help protect your hand from the sun. Okay, let's talk about sunscreen. So it's best to use a broad spectrum sunscreen that blocks both UVA and UVB rays. So look at the bottle to make sure it says broad spectrum. SPF 30 or even higher is better. So I typically tell my patients go as high as SPF 50 or 100. Mineral sunscreen is better than chemical sunscreen, especially for patients that have dermatomyositis and they're very sensitive to sun exposure. Mineral sunscreen usually has zinc oxide and titanium dioxide. I always recommend that my patients, especially the darker skin patients, use the lightweight or tinted formulas because the mineral sunscreen can leave a white cast. You can also mix it with your foundation, and this can help to prevent that white cast. And it's very important to blend, blend, blend. When you're applying it initially, it is going to have that whitish cast on your skin, but you have to really blend it and rub it in very well, and with time it will absorb into the skin. And these are just a few examples that my patients really like, and it blends very well into the skin. Always apply your sunscreen before going outdoors. Make sure you apply enough sunscreen and rub it in thoroughly. Apply to all sun-exposed areas, and reapply the sunscreen if you're going to be outdoors for more than 2 hours. Reapply immediately after you swim or after sweating also. Now, what can you do to prevent worsening of the rash? There are actually certain things that we do that we think it's better for our health. It's advertised as being good for our immune system, but some of these things actually overly activate the immune system and make it harder for us to treat your autoimmune diseases. So examples are of these supplements that cause an overactive immune system include spirulina, echinacea, chlorella, alfalfa, and these have been reported to induce autoimmune diseases. So it's almost like they rev up your immune system and make it worse. And then there are actually some supplements that make you more sensitive to the sun, including ginkgo and St. John's wort. This is actually a recent article that was published, and Dr. Victoria Worth is one of the experts, the world experts in dermatomyositis, and she has published this article to show that there are supplements that lead to autoimmune or cause or worsen autoimmune skin diseases. What can you do to prevent worsening of the rash? Well, there are skincare products that make you more sensitive to the sun. So be very careful with your over-the-counter skincare products. Anything containing alpha and beta hydroxy acids, such as the salicylic acids and the lactic acids and the glycolic acids, can make you more sensitive to the sun. Retinols, hydroquinone. So hydroquinone is one that I always tell my patients, because patients with dermatomyositis, once their rash goes away, sometimes it can leave hyperpigmentation or brown spots or brown scars. And hydroquinone is a bleaching cream that we can sometimes use to lighten those scars. But hydroquinone makes you very sensitive to the sun. So sometimes I'm wary to give it to my patients with dermatomyositis because it increases sensitivity to sunlight. Benzoyl peroxide is a very common acne over-the-counter medication that's in skin products that can also make you sensitive to the sun. Essential oils, certain essential oils, especially if they're in the citrus family, can make you more sensitive to the sun. And then prescription retinoids too, that we use for acne, can make you more sensitive to sunlight. Be aware of oral medications that can increase sun sensitivity. There are certain antibiotics that can make you more sensitive. NSAIDs, over-the-counter, ibuprofen and naproxen, even antihistamines that we recommend for itching. So for our patients that are very itchy, we commonly would recommend antihistamines, but we have to bear in mind that these antihistamines increase sun sensitivity. And then some diuretics or water pills can make you more sensitive to the sun, especially the hydrochlorothiazide. Okay, now what can you do to take care of your skin? Well, you can, if your skin is dry, scaly, rough, and itchy, I always recommend moisturizing. Limit your shower or bath time to 5 or 10 minutes. Use warm rather than hot water. Wash with a gentle, fragrance-free cleanser. Blot your skin gently to dry with a towel. Slather on the moisturizer immediately to trap the moisture in the skin. Apply hand cream after each hand washing. Use an ointment or cream instead of a lotion. And use only gentle, unscented skin products for your skin. Thank you very much. Now